Before I actually do this, I'm going to shorten this wire. It's bent in the mouth, and it's not going to be this long because you cut it last time. So I have a distal end cutter. I'm going to go ahead and cut the ends of the wire to the approximate location of where the wire would end, probably a little longer. Okay, now it says that what was actually done in this case is on 3-1, you can see that the tooth is kind of down, and 4-1 we need to step it up a little bit more on the mesial. So there's a bend already on the mesial, so mark both sides, mesial and distal. Just ignore that there are bends there, to tell you the truth. Just act like it's just a regular straight wire. So mark both sides, mesial and distal. Just ignore that there are bends there, to tell you the truth. Just act like it's just a regular straight. You make bends again on the mesial and distal of 3-1 and 4-1. Okay? Thank you, patient. You take the wire out. You orient it towards yourself so that you can see and make sure you don't bend it the wrong way. And you're going to get the plane here correct. I want to go straight up. Okay? And I think I'll start here. I have my plier on 3-1 distal. So you can see I want to bend it up, not a lot, just a little, right? Okay, so maybe like a 10-degree bend or so. Okay, now the problem with this is that you can't always see your bend. Okay, now the mesial of 3-1 has already gone up with that bend. And I don't really want to bring it down because I want the mesial of 4-1 to go up even further because the first bend was not enough. So I just bent 3-1 up. There's a little dimple, and now the bend on 4-1 mesial looks bigger than it was in the beginning. It looks bigger than it was in the beginning. 3-1 just has a little, it's like almost like a 1/4 millimeter step up, huh? And if you think it needs more, then you add to that. So what we're talking about here is adding to an existing wire, and you act like the wire has no bends in it at all. You just mark the wire, make a step up where you think, ignore all the other bends, and I think maybe I'd probably make that just a little bit bigger than I made it on 3-1 distal. So again, the magnitude is you sort of looking in the patient's mouth how much the tooth needs to be moved. Okay, so I just made a little bigger bump right here on 3-1 distal. Okay, so once the wire adjustment is made, then you would insert the wire yourself, being the one that had made the bends. But before I do that, it says I also need to skew the wire to the left for the midline. Okay, so this is the middle right here where my 4-1 mesial bump is. We want to like bend the wire out on this side and in on the other side, right in the like cuspid area. Okay, so what I'm going to do is I'm going to take it in my fingers like this. Now I'm going to press in with this finger and I'm going to push out with that thumb to skew the wire to the left. Okay, you see that? Okay. All right. And now the wire is skewed to the left. That's what you do. Just take your fingers and try to move it. So it's not symmetrical anymore, okay? It is lopsided, in on one side, out on the other.